Hi, welcome to our second Facebook Live session today. Thank you for joining us, and we have our lovely Dr. Briscoe who will be talking on the topic that is hormonal migraines today with all of you. Thank you for sending in your questions and everything. Just a bit of thing. Really sorry about the bit of background noise that we have. It's just the heat waves on and we've got fans around. We just couldn't survive without that. So just bear with the noise, and we're sorry about that. You've sent us loads of questions and the responses are fantastic. We will try and cover as many as we can during the course of the session, but do keep commenting in more questions. We would be looking onto that once we've had run through the session. At the end, we will be talking about the questions you kind of put up in the comment section. And off to Dr. Briscoe.
Yeah, so we chose the topic hormonal migraine, largely because most of the women that we see here and most of the questions that we get are related to hormones. So people want to know how they can identify whether or not they've got hormonal migraines or menstrual migraines, and I'll talk about the difference in a little bit. And how they can, basically how can they work out that's what it's causing, that's what's causing their migraines. So changing hormone levels can happen at different times in your life, and that can make you more or less likely to get hormones. So we want to talk a bit about that and how you can manage it when it does happen.
Well, to start off with, Dr. Briscoe, what I wanted to know is that we do know that migraine affects women way more than it affects men. So it's like 3 times. And it's usually their most productive ages, and a lot of that is linked to their hormones. Now, what is it about hormones that makes it so difficult for women?
Yeah, so I guess we have to think about what's actually happening during the menstrual cycle. So when people are in their reproductive ages, there are certain hormones that are more likely to trigger migraines than others. So there are sort of two types of migraine: the hormonally associated migraine and menstrual migraine. Talking about the different hormones that affect people is linked to the menstrual cycle. So day 1 is the first day of your period. After that, the egg starts to be developed in the ovary, and that's when you start to release estrogen. So in the first half of the cycle is really dominated by estrogen. The levels slowly start to rise to the midpoint of the cycle when ovulation, egg release, happens, and you get a bit of a spike in estrogen at that point. Once the egg is released and starts travelling down to the fallopian tubes towards the womb, progesterone starts to be released so that the lining builds up ready to receive the fertilised egg. If the egg isn't fertilised, the lining and the egg are both released, and you get a gentle drop in estrogen levels and progesterone. Now, with hormonally associated migraines, those various changes in hormone levels can be one of many triggers that are likely to cause migraine. With menstrual migraine, it's a little bit more specific. So there are 2 theories of that. First is that it's the drop in estrogen levels that happen a few days before the period starts that is the big trigger for migraine. So they tend to have their migraine a couple of days before their period. Those types of migraines are usually without aura, and they can be a lot more prolonged than other migraines. The other theory is that it happens when a substance, which is also related to heavy periods, called prostaglandin is released, and that tends to happen in the first couple of days of the period. So really, menstrual migraine, you can set your clock by it, or your watch by it. So it happens between a couple of days before the period and about day 3 of the period. Whereas hormonally associated migraine is changes in hormone levels which can act as a trigger, a bit like any of our other triggers. So an irregular diet, irregular sleep pattern, heat or changes in barometric pressure, light sensitivity. Hormones is another one of those multiple triggers that some people are more or less sensitive to than others.
And as you mentioned, so menstrual migraines, because they're so specific, it sounds like, and if you are regularly maintaining a diary, you might be able to kind of identify that.
Yeah.
Okay, do I actually suffer from it or not? Is that what's triggering me? But with hormonally associated migraines, how would one identify that as a trigger? How do you know that's what's triggering the migraine?
It can actually be quite tricky. Looking back into the past, you want to look at your history. So when did your migraine start? Was it at the same sort of time as puberty, so when your period started? People who tried the combined pill, because sometimes the estrogen in that can actually trigger migraines, is that something that caused your migraines to get worse. And again, try to keep a diary. So some people occasionally have migraines at different points of their cycle. It tends to be a bit more random than it is for people who have the menstrual migraine, but they can start to notice a little bit of a pattern, like at day 13 during ovulation, or the week before, or the week after, but at more varying intervals. So keeping a diary is still really important, actually, if you have.
And it sounds more like it's more about stabilising those hormones, isn't it? So if you just stabilise your hormones, does that solve everything? Does that just do the migraines just go away?
That would be amazing. It's not always about. It doesn't work in everybody. Some people can find that stabilising their hormones, so usually with one of the pills, can actually cause their migraines to improve. We're never going to promise that we're going to get rid of migraines altogether. Any preventative improves the frequency and severity of migraines by 50%. Some people do get rid of them altogether, but trying to reduce them or improve them is really our aim. But it isn't the only option.
Okay. And with migraines, a lot of times it's just when people kind of talk about pills, they always say that contraception, you get questions like that, and you have, should I be doing a progesterone only, sort of pops, or as they call it, or they would say, is the combined pill better? So it's always that question that they have.
Well, we also have to remember it's not just the pills. The coils, particularly the Mirena or Jades coil, which both secrete progesterone, they can help to keep a more steady state of hormones. The combined pill isn't suitable for everybody. So if you have migraine with aura, you shouldn't take the combined pill because you have a slightly increased stroke risk associated with being on the estrogen part of the pill. But if you're someone who's particularly sensitive to estrogen, you may find that having taken the pill, it actually makes your migraines worse. So a lot of doctors prefer to give people the progesterone-only pill if they know they have migraine, because it takes out the estrogen component and it gives a slightly more steady state of hormone. But some people can find that their migraines don't really change from that. It's like with any preventative, not everything will work for every person.
And what about the pill-free days? They do have a pill-free day, and they will be like, okay, so everything's been normal. All of a sudden, I've got 7 days of pill-free day, and the migraine just comes in.
Yeah, so that's particularly people who are sensitive to estrogen. So the combined pill, you have your 21 days with a 7-day break, traditionally. So it's that drop in estrogen level that can trigger a migraine in some people. So particularly with menstrual migraine, but also people who are quite sensitive to estrogen, we advise that they can try cycle or push pills together. So that's where they take the 21 days and then they just start the next pack immediately afterwards. We then advise that they keep taking the pill until they get a breakthrough bleed, and then after 3 days of bleeding, they start the next pill. And as time goes by, that time tends to lengthen so that they'll have a period every sort of 3 to 6 months, really.
Okay, and now because these are hormones, a lot of times, and nearly 90% of the women actually feel that, is that they would have a triggering headache or migraines when they are either perimenopausal or they have their menopause stage.
Mm-hmm.
How would you recommend they manage their migraines then?
So with the menopause, a lot of women do benefit from HRT, but again, not everybody does. Some people can find that HRT can make their migraines a lot worse. The rule of thumb is that we like HRT because again, it stabilises the hormone levels a little bit more. It can also help with the other menopausal symptoms that people get, such as flushing, sleep disturbance, mood changes, muscle and bone aches. But the other option is the Mirena coil, which is also licensed as part of HRT and during the menopause, and that can keep the hormone levels a little bit more stable in some people.
Okay. We had a question from Julia who said, who basically asked was, is HRT the only solution? Can they use a different preventative as well?
Yeah, so you can. So as I said, not everybody even benefits from HRT, or it's not suitable for everybody. And as with other migraine, you can, if you're thinking about hormones as a trigger, so it's not sort of, you want to try and raise the threshold. Okay. So you can use another preventative, so propranolol or amitriptyline or any of the other types of preventatives there's a 1 in 4 chance of any preventative working, so it's really difficult for us to know which one will help when we start. We try and tailor it according to people's symptoms, but other preventative medication can be beneficial in any kinds of in any of the hormonal migraines.
And Christine, remember, had sent a message saying, can HRT actually be a trigger as well for migraine?
Yeah.
That's interesting.
Yeah, so some people can find that the estrogen component can trigger migraines. Also, generally when you're starting any form of hormonal treatment, that sort of sudden change in levels can make migraines a little bit worse first of all, and it can take a bit of time for the body to get used to being on any form of hormonal treatment. So when starting the pill, HRT, or having the coil inserted, we always advise people to give it at least 3 months, because usually the body's got used to the medication or the treatment at that point, and people should start to feel the benefit from then onwards.
Okay. And so when does the body actually stop reacting to hormones after menopause? It was Gary and Kim, if I remember, they asked this question. When is it that it stops?
Yeah, that's a really difficult question. We were always taught that menopause happens sort of in your 50s and it stops when you go through it and you've gone through
But
it.
that doesn't happen anymore, isn't it? With the perimenopausal stages and the post as well have just got stretched a bit.
Yeah, so perimenopause is about 7 or 8 year period of time where your hormone levels are fluctuating. So you can still be having periods, you can still be quite young, and you can still be fertile as well. But it's that your hormone levels are changing. You'll then go through the menopause so that your hormone levels are flat, but you can still have a little bit of residual hormone which can cause problems. I mean, clinically, I've seen it in people who are in their late 70s, early 80s. So there can be some symptoms occurring a bit later on. It's not the same in everybody. The majority of people will stop having their symptoms a bit earlier, but there are people who still have menopausal symptoms a lot later than we were taught.
Okay, and so is the line of treatment still the same?
So it really varies. HRT isn't always suitable for everybody as they get older. Your relative risk of developing complications changes. So that's a conversation that you should have with your doctor according to what your other medical problems are and what your age is. But there are the other treatment options available, so other preventative treatments are sometimes a bit better if you're a bit later in life and having issues with hormonal changes and migraine.
Okay. Now, there was a question from one of the viewers earlier, and it was about pregnancy and migraine. And I know at the clinic we do get them loads and loads of time. It's, do migraines get better? Do they get worse when somebody's pregnant and post-pregnant? Like, how does it go?
Yeah. So again, if you look it up, everyone will say that migraines improve in pregnancy. It's not always the case. Some hormonally sensitive people can find that their migraines worsen in the first and second trimesters, so when the hormone levels are changing, essentially. I feel like I talk about changing things quite a lot. But so those 2 periods, so the first 2 trimesters tend to be the worst during pregnancy. Usually improves in the 3rd trimester, but your migraines can get worse later on, so after you've given birth, when the hormone levels are settling back down to normal, and also during lactation or breastfeeding, people can find that their migraines worsen as well.
And the major concerns that usually women have when they're pregnant or they're about to get pregnant is what medications can they actually take, even while they're pregnant and post-pregnancy, like during the breastfeeding time.
Yeah, so that is a worry that a lot of people have, because we obviously advise people that if you can avoid taking medication during pregnancy, you should. But obviously migraine is very disabling and can be really debilitating as well. So in that case, the benefits outweigh the risks. Simple painkillers that can be helpful. Aspirin would probably be my treatment of choice during pregnancy, which is safe to take in the 1st and 2nd trimesters. You can take other types of the non-steroidal family, so naproxen again would be another choice. And triptans, again, it says in the book that we all use, which tells us about whether medications are safe, that it's not safe to use sumatriptan in pregnancy, but actually trial data does show that if the benefits outweigh the risk, it is safe to use during the first 2 trimesters as well.
And there was this question from Hilly, and she wanted to know if there are any natural ways of treating hormone migraines.
Yeah, so I think the best evidence for managing menstrual migraines in a natural way is using magnesium supplements. So we advise that in actually one of our leaflets about natural alternatives, we do advise that magnesium is one of the options that you can use. It can be quite good for premenstrual tension type symptoms. It's good for muscle aches as well, and it's good for regulating sleep. So the advised dose is 600 milligrams at night. It can cause side effects of diarrhea and abdominal pain as well. So if that's the case, it's worth reducing the dose to around 400 milligrams.
Okay, that's quite interesting. I'm just going to the questions that have come through, and there's one that Gemma wants to ask is, if you're not on the pill, is there anything you could do to reduce the frequency of your hormonal migraines?
Yeah, so looking at your other risk factors as well. So keeping diaries really is key. So having a look if there are other risk factors involved, so regulating your diet, trying to keep your blood sugar level stable, also regulating your sleep as much as possible, reducing any potential stressors, so work-based triggers, so anxiety or problems with your workstation such as flickering lights, computer problems. Some of the other natural remedies can be used. So magnesium is one of the ones I suggested. Riboflavin actually works quite well with magnesium, I found in practice. So riboflavin is vitamin B2. That's you take that at a dose of 400 milligrams in the morning. And then other preventatives could be an option. So amitriptyline is one that I like to use quite a lot. Again, that does help to regulate sleep, so people tend to take it about 6 to 8 p.m. just before they go to bed, or other preventatives such as propranolol as well, a lot of people use.
And as we're talking about natural remedies, I think there was one of the questions in here, Liz, that wants to know that, can acupuncture help?
So there is evidence for acupuncture. I'm not actually sure what the evidence is specifically relating to hormonal migraines,
yeah.
But in the trials, they did quite high frequency of acupuncture in the trials. I think it was 3 times a week people had to have it, which isn't really that in real life. That's not particularly easy to do. But in clinic, I have noticed that a lot of people have had benefit from acupuncture, but it is practitioner dependent. So it really depends who you go and see. It can be worth trying because some people do find it helpful, but you do have to keep going, and sometimes the effects wear off once you stop it.
Lots of questions coming in, but I'm just going to pick up. And Jim also wanted to know if there are any good foods that you would say that help people suffering with hormonal migraines.
Good foods. So with food, I tend to steer away from specifics. So when I'm talking about foods that help with migraine, I think about things that are more likely to keep your blood sugar level at a steady state. So trying to avoid very sugary things, which can actually be difficult during your period anyway, because often people crave sugary things. Trying to eat little and often. Going for more complex carbohydrates, or the brown things, brown rice, brown pasta, wholemeal bread, rather than the white varieties, because they are slower burnt, so that you'll get a more steady state of the sugar level. Pairing it with protein as well, and making sure you drink plenty of fluid. But there's no specific foods that I can think of, I'm afraid.
And that answers something for you, Gemma. But Katie wanted to know that you just mentioned about magnesium and B2 supplements, and she wanted to know if there's any time period around the month, or do you want it to be taken throughout the month?
I would advise to take it throughout the month. So usually, because again it tends to be working to raise that threshold, a bit like the prescribed preventative medications, I usually advise people to take them for at least 3 months.
One of the questions that came through was hysterectomy, if I'm pronouncing that right.
Hysterectomy.
Yeah. Does that make things worse or better?
It's slightly controversial. We used to do a lot more hysterectomies anyway. If you feel that you've completed your family and a major surgery would be a safe option, some people, if you remove the ovaries as well, sometimes you can remove some of the sort of hormone, some of the triggering hormones, but you get a sudden drop in hormone levels. And if you're young, we'd advise to take HRT anyway from a bone health and heart health point of view, which can bring problems in itself. It is very major surgery. It's not something that's easy to get away from, so I certainly wouldn't use it as my first line. I would definitely go along some of the other routes first of all. But if you're desperate and you've had a chat with your GP about it and you've seen a gynaecologist and they agree, it potentially could give benefit.
Thank you so much. And I think I'm kind of running out of time now. My colleague just showed me that we are definitely running out of time. And so, what would you final takeaway points that you would want people to just look into?
Okay, so the first thing is the best way to identify the type of migraine you have is to keep a diary. I know we talk about it a lot. It's really important, and we actually really like looking at diaries. So keep 3 months of diaries at least, and try and track your periods with it, whether you're taking any kind of hormonal treatment, to see whether there is a link between your menstrual cycle and your migraine, and actually to see if you can identify any other triggers. One of the other points I'd make is that treatments are very individual. There is no one size fits all, particularly for menstrual migraine. So you may find that someone with a hormonal migraine has one treatment that suits them, but for you it might be something completely different. And it also sometimes takes a bit of time for the treatments to work. So I would advise to persist with any treatment for at least 3 months.
Well, as Dr. mentioned, whatever information we've shared today, whatever has been discussed, is more on the general route. So if you need to know something more specific, something pertaining to your personal self, please do refer to your GP or see a headache specialist. You can come and see us, but yeah, please do see a GP or a headache specialist to get the right advice for you. Do not self-medicate. That's something we're going to be saying. And once again, thank you all for joining us today, and we want to do more and more sessions and reach out to more and more people. So do share and like this video, but do send us your questions, do send us the topics that you'd like us to cover, because it's fantastic to know from your end what is it that you wanted to know, and our experts can then provide you with information. And just a final thing, we are a small charity over here in London, and we've been seeing patients for the last 38 years and we've been committed to helping migraine sufferers. So if you are suffering or you know somebody who is, do give us a ring and we should be able to help you. You can come and see our headache specialists. The consultations are way longer than the NHS ones, and the wait times are way shorter. All the information is there on our Facebook page. You can just call us, go to our website, have a look at that. Everything that's been discussed over here are part of our fact sheets as well. So you can go to our website and have a look at the different fact sheets that covers these topics. But you can definitely give us a ring or send us an email. And thank you once again. Take care. Bye-bye.
So hot. Was it too bad?